Now, more of Patricia Raskin, Positive Living, on News Talk 630 WPRO and 99.7 FM. To speak with Patricia and her guest, call 438-WPRO or toll free at 1-800-321-WPRO. Now, here's Patricia Raskin.
Hi, everyone. We're back. We're back with Patricia Raskin, Positive Living, and we're talking about a very interesting topic today, infants in dentistry and laser. And our guest in the studio is Dr. Martin Kaplan. He's the president of Kid Care Dental, PC. Dr. Kaplan continues to take advanced training and recently gained master's proficiency in laser dentistry. He's only a handful of pediatric laser dentists, and we're talking about pediatric dentistry and lasers in dentistry. Welcome, Dr. Kaplan. Okay, so tell us what pediatric dentistry is and what the ages are.
Okay. Pediatric dentistry is a specialty from the American Dental Association that was actually started around 1942, and it's a specialty program which takes anywhere from 2 to 3 years beyond being a regular dentist, graduating from a 4-year dental school. And we specifically study infants, children, special needs children, even handicapped adults, and different people, different situations where children may have medical problems, cancer, diabetes, seizure
disorders. And what ages?
Anywhere from, in my particular case, I'm even seeing some newborns, but everybody, all the pediatric specialists that I know at least had some experience with some even infants being born with teeth, and occasionally there's some problems that the children have because of that, because they can actually even swallow a tooth that they were born with, which most people aren't aware of.
Wow.
So sometimes, a couple times a year, I get called in by the pediatricians to see these children.
Right. So the general ages of children in your practice are 6, 8, 10?
General age is anywhere from 3 to about 8, but there's been a push for about the past 10 years through the Academy of Pediatric Dentistry, the American Dental Association, and the Academy of Pediatric Medicine that they want all children to have a dental visit by the first year of birth, because there's a lot of dental issues that you can find at this particular age.
Okay. Now, you've been in practice for 36 years, and you've been using dental lasers in your practice for almost 10 years.
Yes.
How did you become involved in this newer technology and get your training?
A few years before the 10 years where I got involved, there was a procedure that I learned about called air abrasion, and that was a way for a dentist to be able to remove tooth decay in whether it was permanent teeth or baby teeth without using a drill. There was an air pressure being pushed out by a dental handpiece with these particles called aluminum oxide, which are just small crystals. And these crystals would blow across the tooth and actually remove some decay without the pressure of the drill, the noise of the drill. And so some very simple areas of tooth decay can be removed, and then you could put sealants or some simple restorations on it without any pain or discomfort. From that, I started to notice, or I heard through different organizations, that lasers were becoming popular in dentistry, and I was trying to see if there was something that myself as a pediatric dentist could do, because I knew most of the laser surgery initially from about 20 years ago was done by oral surgeons to do some kind of jaw surgeries. And then there was some development about 15 years ago that lasers could be used to remove tooth decay. But the biggest thing that I became aware of was some gum surgeries that could be done, so I took a few courses, and from there it just was a natural development for me to just learn more and more about it.
So you treat newborn infants who are experiencing nursing problems.
Yes.
And now, how did you learn about this problem, and what can you as a dentist do to, assist our listeners who may know people who have relatives or friends or themselves who are experiencing problems right now breastfeeding newborns?
Sure. Well, essentially about 3 or 4 years ago, I learned about the ability for myself and several other dentists to be able to treat infants. There's an academy that I'm in called the Academy of Laser Dentistry, which is, I think, celebrating 20 years of being in existence now. And when I first started doing my laser training, I wanted to get even more training, so I found out about this academy, and I went through training and some advanced training for it. And there was a few pediatric dentists, one a good friend of mine in Albany, New York, Dr. Larry Kotlow, who was expressing to me that he's been treating infants that had nursing problems because of some developmental problems that these children had that was interfering with them from breastfeeding with their mothers. And then we developed, actually, well, not we, but a few other dentists got together. And now every year in the academy, there's actually a one-day seminar where pediatric dentists learn about all the different procedures that we can use lasers on children.
Explain why the newborn baby has trouble breastfeeding. What is the problem, and how do you correct that? Well,
what the problems would be is the mothers would have a history of having painful breasts. They would have mastitis. They would get bleeding breasts. The children would have histories of having gas in their stomach, burping. They'd be tired and fussy all the time. They couldn't hold on to the mother at all to latch long enough or to be able to breastfeed.
So the baby's mouth can't move over the nipple.
Right, correct.
And the reason is?
Well, the reason is in the cases that have a dental background in it, about 3 to 6% of the children that are born have these fibers or remnants of fibers in their mouth under their lip or on their tongue called the lip tie and a tongue tie, and interferes with the children getting a proper suck by latching onto their mothers. Mm-hmm. And if the latch is improper, then it causes a lot of pain and gumming to the mothers, and they get abrasions. Some of the children even have come into me with calluses on their lips. Mm. And a few kids had even gastritis because they couldn't latch on more enough. They were taking in air instead of breast milk.
So what do you do? What's the procedure that you do?
Well, the procedure for us is to evaluate to see if the problem is legitimately something that I could treat. Because just because they come in, it doesn't mean they need treatment by myself or anybody else. So what you do is you evaluate the lip, and by doing that, the top lip, I put a gloved finger on, and I rub my finger on the inside of the lip to see if there's some kind of an interference from me going from one side of the upper jaw to the other. And if there is one, I'll note that, and there's different categories of it. There's actually a rating system for it from 1 to 4, which is more of a technical rating system that's really not practical for this talk. And then I would also look at the tongue to see if there's a problem with the tongue, because most of the kids that do have problems that people are aware of have a lip tie. And there are actually two types of ties. There's a lip tie and a posterior lip tie. So there's a way to evaluate that by putting your hand in and feeling for certain things too. But the biggest thing that you need to be aware of is if the mother is if she has a history of pain and discomfort, and if the child is having problems, then that's the determining factor, because you may have some problems anyways.
All right. What I want to do, we're going to have a whole other segment, but we've got about 3 minutes left. If you're listening to this and you're a mother who's breastfeeding, or you know someone, you have a friend, it could be a daughter, a daughter-in-law, it could be a relative, anyone you've heard of this and you're hearing about these problems, give us a call or call them and tell them to call in. We'll also give you Dr. Kaplan's contact information, because although this is new in a lot of ways, isn't it?
Yes, it is relatively new. It was something that was ignored. There's even the medical professions, most people aren't aware of it. I had a situation recently where a mother who works for an ear, nose, and throat specialist in the New England Medical Center came in to see me because the specialist she worked for didn't agree that anything existed. And after we performed the treatment, within 2 to 3 days, the baby was growing again and not fussy. And 2 weeks later, when they came in, the baby was awake and alert and smiling.
And this is an outpatient procedure.
100% outpatient, so you can avoid going into the operating room, the expense of going in, the stress of going under anesthesia.
Is this covered by insurance?
I'm not aware of if it is or not, to tell you the truth.
Okay. All right. Well, folks, I want to give you the number, 438-WPRO-9776 or 800-321-WPRO-9776. If you know anyone who is experiencing difficulties with their newborn, with breastfeeding, do give us a call, because Dr. Kaplan really is on the cutting edge of doing this work with lasers and with helping the newborn and the mom. So we're happy to have him here today. And let's give your information to the listeners, please.
Which information?
Well, it could be your phone number and however for them to call you, contact you.
My office phone number is 781-341-0320, and my office is in Stoughton, Massachusetts. The address is 1613 Central Street.
All right. Give that a number out again.
781-341-0320.
All right. And we're going to have Dr. Kaplan on for the next segment as well. So you're